I recently had a patient come to my clinic with sialosis, and this is a fairly rare condition that I see maybe once a year, once every 2 years, and it's not very common or very well known, so I thought I'd make a video for other people that may be dealing with it. So sialosis or sialoadenosis is basically a not dangerous and not painful. There's no symptoms from it. Swelling of usually the parotid glands. So this is the best paper that I found dealing with it. So this was published in 2008 in the British Journal of Oral and Maxillofacial Surgery. And so they describe it, it's chronic bilateral diffuse non-inflammatory, so this means it's not infection or any kind of inflammation, non-neoplastic, so it's not a tumor, painless swelling of the parotid, so sialosis or sialoadenosis. Um, this has been known for a long time, so about 50, 60 years. And in the first paper that was reported on it, most of the people had chronic liver disease and the remainder were obese or had hyperglycemia. So in this paper, they review 35 patients. And what I like about this paper is they kind of summarized all the previous work and all the previously known etiologies or causes of this condition. So this is not a dangerous condition. It's not a tumor or cancer, and it's not an infection, so you can't clear it with antibiotics. And the main treatment of this is to fix the underlying cause, like what's the thing that caused it to happen. Um, and mainly the problem is that it's kind of cosmetically deforming because it makes you look like you're a little bit of a chipmunk, and you have really large cheeks. And so some people don't like the look of that, and so they want treatment for that. So, yeah, so this is a picture where you see like the cheeks are kind of swollen here, and it's usually on both sides. It's almost always bilateral. But this is the part of the paper that I thought was the most useful, is that they kind of summarized all the known causes of it. So a bunch of drugs are known to cause it. The most common ones would be like antihypertensive drugs, iodine, naproxen, or the name in the drugstore is Aleve, and then valproic acid, which is a anti-seizure medication. And these other ones are a little bit less common. And then these are the most common reasons are the endocrine and nutritional reasons. These are sort of rare, but they are acromegaly. This is kind of a rare problem where the pituitary makes too much growth hormone. Alcoholism is a very common cause of sialoadenosis or sialosis. And then diabetes, hypothyroidism, liver cirrhosis, and uremia. Uremia is too much urea in your urine, and that is usually a sign of kidney failure. Then a nutritional deficiency, so beriberi, that is a thiamine or vitamin B1 deficiency. Bulimia is a condition where people like eat a lot and then they purge to lose weight. Gastrointestinal disease, malnutrition. Pellagra is a niacin deficiency, so another B vitamin. Amylophagia is a type of pica where people habitually eat starch, like cornstarch or laundry starch. And then vitamin A deficiency. So in their case series, most of them had um, either alcohol abuse or diabetes and obesity. So yeah, so this they don't mention this, but this diabetes mellitus is highly associated with obesity. So obesity is basically the major cause. Diabetes and obesity, those two are the major causes of sialosis, and then alcohol is the second most common cause, and then everything else kind of is probably everything else put together would be less than the other two. So basically, the the goal of treating sialosis is to treat the cosmetic deformity, and the way to treat it is to find out what the underlying cause is and treat that. Now, sometimes it is idiopathic, which means you can't ever figure out what the cause of it is, And so, people aren't taking any of the medications that are known. They don't have any of the endocrine or nutritional problems. In that case, it is a cause that we haven't discovered. So we call it idiopathic. Um, and then in those cases, if people really want something done about it, you can do surgery and do a parotidectomy and surgically reduce the bulk of the disease. But that has a major risk of damage to the facial nerve and some potential other problems. So we generally don't recommend surgery. Surgery is not a recommended treatment for sialosis, and that would be undertaken in just some very rare instances where people were willing to undergo the um, the risks of the surgery, which are facial paralysis and bleeding and anesthesia risks. Um, and they've eliminated every other possible cause. So they've lost weight, they've maximized their diabetes control, they've stopped drinking alcohol, and treated every other possible underlying cause. And at that point, surgery might be an option, but it would be kind of an option of last resort.